The opioid crisis is sweeping through North America. We're obviously not immune to it. We are going to more overdoses than when I started 18 years ago.
I think it's more prevalent today because of the strength of the drugs that are being consumed.
If we don't get a handle on this crisis, people will continue to die.
And how long have you been using that prescription for?
For about a year.
Opioids are all medications which are a morphine group of substances. So if somebody's had an accident or a surgery and is having pain because of these reasons, it's justifiable to give them an opioid prescription.
I fell and hurt my back, and I've been getting my doctor to prescribe it.
However, what is very important is short duration opioids. It is a medication that makes you very dependent. Also, the brain gets, I would use the word, hooked onto it.
What brings you in today?
Well, I'm having some addiction issues.
The root causes of addictions in Saskatchewan are both the use and abuse of prescription medications.
Once somebody's dependent and hooked on to a drug, there's going to be a different way their brain mechanisms work.
Addiction is a disease. It is a chronic disease.
What drugs have you become addicted to?
Mostly prescription.
Patients who may legitimately have started on a prescription for something are over time becoming tolerant to that and needing more and more to get the same effect, and eventually are starting to misuse drugs and then going to the street eventually if they can no longer fill with doctors or other providers.
These medications are being available on the streets and are being bought and sold on the streets and are being introduced to people on the streets.
It really brings about a couple of strong concerns. Number one is how easily accessible these drugs are. They're being manufactured in basements and garages, and so oftentimes there's not a real science going into the development of these drugs, and so you can see lethal combinations of different ingredients being put together.
Fentanyl is extremely dangerous. Fentanyl on the street is not measured out. The fentanyl on the street is deadly potent.
I think the potency of fentanyl is what leads it to be so destructive and dangerous. People can die from it from one use.
Kids and teens, young adults need to know that just one-time use at a party could be detrimental. You think you know where you're getting your drug from. Nothing's safe.
I'm here today to talk to you about your take-home naloxone kit. Okay. I think what people need to realize, though, is addiction is not a choice. People didn't take medication prescribed by their doctor thinking that it was going to cause an addiction problem. You're going to find...
But it sneaks upon you because it's very insidious. We, doctors, are responsible for part of this crisis. We have overprescribed these medications, and we have been really lax in following up with patients that we've prescribed these medications for.
It's important to follow the instructions of your physician or nurse practitioner in regards to follow-up and when you no longer need those medications.
So you can come off slowly at a taper that is suitable and conducive to you. Way forward would be education, education, and education. And then if addiction happens, then early intervention.
So let's talk about options for treatment. Addiction is something that can be treated. It's something that patients can beat. It's something that patients can overcome, and they can go through their lives successful.
Opioid substitution therapy actually gets patients their lives back.
When they're ready, they're looking for the help, and we should be there at that moment when they need it. and not say, come back next week, not say, come back next month.
We absolutely cannot arrest our way out of this problem. The addiction problem in our community is something that is much deeper than that.
I would say to people that are struggling with addiction to make sure you reach out for help.
You need to know absolutely categorically, number one, you're not alone. Number two, there is help.
The ultimate cost of this addiction crisis is the death of our loved ones. If we don't get a handle on this crisis, we will continue to lose the people that matter in our life.